Hello, my name is Hannah Wright. I am the lead trainer here at Photonica USA. So what I'm going to be doing today is I'm going to be demonstrating with you on how we take optimal measurements on the female body. Every step that I go over with you will also be pretty much the same for men as well. Okay, so let's go ahead and get started. Alright, so I would like to talk about the type of measuring tapes that we use. So these measuring tapes that we use are very user friendly. I do want to talk about what's on the back here. So this right here on the back of our measuring tape talks about how there is a 2-inch gap here, because you'll notice that when you pull the measuring tape out, it starts with 2 inches, okay? So when you're wrapping that measuring tape around your patient, it's already deducting that 2-inch gap right here for you. Another reason why we like to use these specific measuring tapes is because we can easily lock it in place as we're going around our patient and making adjustments. So when we are using the measuring tape, we want to hold the measuring tape in our left hand with this red button facing upwards, okay? So you're going to have your left thumb on top of the red button to pull just a little bit of the tape out, then you will let go, and then you can go ahead and begin with your measurements. Next, I want to talk about the measurement form that we use. This measurement form that we use can be located in our provider portal. It's called the Inch and Volume Loss Calculator. Now it's called a calculator because when you are using it electronically from the portal, you can actually use this as a calculator. When you print it out, that's when you're just going to manually enter in your measurements, your before and after measurements, and then you can go back and use the portal to calculate your total inch loss for your patient. Okay, so now we're going to begin on how to take optimal measurements for the female body. Okay, so what I'm going to ask my female patient to do is bring her feet together as close as she possibly can. And the reason why we ask our female patients to do this is because we are going to be measuring the hip and bottom area. So we want a consistent place on where the feet are going to be. Okay, now we're going to go ahead and keep her feet close together as we begin taking measurements in the abdominal area. Now the next thing I want her to do is I'm going to ask her to bring her hands up to her collarbone, make sure her elbows are even and parallel with the floor. Now we want to always make sure that they're even and parallel with the floor, because if the arms are constantly moving, that can actually skew the measurements in the abdominal area, okay? All right, and next thing I'm going to ask my patient to do is just stand nice and tall. Take a deep breath in and breathe all the way out. And I make sure that I'm watching the movements of their stomach. This is also very important because sometimes we don't realize that we are not breathing all of the way out and relaxing our stomach muscles. Okay. Okay, so now I'm going to go ahead and begin doing my measurements on her. Okay, so the first thing I want to do is I want to observe 3 locations in her abdominal from her upper abdomen down to her lower abdomen. So we do a total of 6 measurements on the female body, okay, and 5 measurements for males. Now, the first 3 measurements are always going to be in the abdominal area, like I said, from your upper down to your lower abdominal. And what you're really looking for is the largest apex points of the patient's abdominal area and everywhere else that you're choosing to measure on her going forward. So a lot of the times we will generally choose right under the bra area. So for example, right here. Under the bra area, if they have a little bit of an apex point right here, ideally this is where you want to begin your measurement. But for example, if your patient has no apex under the bra area, the next step that you want to look for is an apex in the general upper abdomen area that kind of peeks out the most, okay? So you have to think to yourself, I want to see a measurable difference, and the best way I'm going to do that is measure that largest apex point, okay? So I'm going to go ahead and use my tape. I'm going to push on that button, pull just a little bit of tape out, and now I'm going to go ahead and go around her like I'm going to give her a nice hug. And I'm going to grab a hold of the tape just like this. I'm going to push on the red button again to bring more tape around and place that tape directly on top of that peak, okay? Then I'm going to lock it in place as I mentioned earlier. Then I'm going to push on the red button again because we're going to have a lot of slack in the tape. So I just want to make sure that the tape just is able to sit on top of her body without the tape falling off, okay? Okay, the next thing I'm going to do before I record my measurements is where I have it locked right here, I'm going to place my finger right here, and I'm just going to gently go around her body like this. I'm not really pulling on the tape. What I'm doing is I'm making small adjustments around her body. However, if I feel places that are loose as I go around her body, I will gently pull on the tape just a little bit to make sure that I have the perfect tautness around her abdominal area. Once I get about an inch away from the handle of the tape, I'm going to bring in that little bit of extra slack, push on the red button, and let go. The great thing about these measuring tapes is if for some reason you pull just a slight bit too tight, the tape will naturally come back out to the patient's natural circumference. Okay. All right, so now we're going to go ahead and record what her measurement is. So we do actually record everything in eighths. Now it just so happens that her measuring tape lands perfectly on 36 inches, okay? So once you have that, what you're gonna do is you're going to go to your engine volume loss form and you're going to write it down, okay? Now, even though it's perfectly 36 inches, I still write down 36 and 0/8, okay? Now, the next step after you have recorded your measurement, you're going to go back and now you're going to make marks all around her circumference so that way, when you are done with her treatment, you're going to know exactly where you need to measure afterwards. And this is where you're going to see the volume loss. Okay, so actually I begin right here where the handle of the tape is, and I'm going to measure underneath the tape, just like this, and I use just a regular pen or a skin marker works as well. I'm going to mark on one side of the handle and then on the other side of the handle, because what I want to make sure that I do is I want to make sure when I go back around that this handle is exactly back in the same location of her body, okay? Then I'm going to go ahead and mark in the front of her stomach, right here. And you don't have to have a lot of marks, just a few. And then I'm going to have her spin around again. And I'm going to make one mark again under the tape on her other side. And then I'm going to have her spin around again. And I'm going to have her, mark here and here as well. So now I have the two on her back side. Okay, and then I just let go. And then I will move forward to my next measurement placement. Okay, so now we're going to move on to measurement 2. So measurement 2, again, you're going to look for the next apex point around her entire circumference, which is generally in her midsection. Okay, so again, I'm going to press on the red button, pull a little bit of tape out, and I'm going to go around my patient where I feel like I'm going to see the most loss in my tape. So it's going to be about right in this area here, okay? So at this point, you're going to see that every step that I went over with you, I'm just repeating my steps through and through, okay? Okay, once I have the tape perfectly in the position that I want it to be, remember, I'm going to go ahead and lift the handle up straight, and I'm going to go ahead and record. And then Miss Diana, if you can just turn to the left. Okay. And again, we actually have her measurement perfectly on 37 inches. Okay, so I'm going to write that down. And then again, I'm going to repeat my step where I make my marks all around her body. Again, always underneath the tape. Okay. Right. Okay. Back. Okay. All right, so on to our third measurement placement, which again is still in the abdominal area, which most likely will be in the lower abdominal area. Okay, now if you have a patient who has underwear that is up a little bit too high in the area that you want to measure, what you can do is you can always just politely ask your patient to move the underwear down just a little bit. So Miss Diane, if you can for me, go ahead and just bring your underwear down just a little bit. Okay. Also, yes ma'am. Also, what would be great is to keep the underwear in this position when you are going to take pictures as well. Because everything that you do, you want to make sure that you are doing it consistently, okay? Sorry. All right, and then if you can just turn to the left just a little. Okay. All right, so again, I am just making sure that I have no space between the patient's skin and the tape. So remember, when you are trying to capture that perfect tension in the tape, you want to make sure that the tape is not too tight and it's not too loose. We want it to be taut, okay? All right, so now I'm going to go ahead and record what my measurement is. All right, so remember we do everything in eighths. So I have 38 inches. And we are counting every other line. Okay, so we have 38 and 1/8, 2/8, 3/8, and then we're going to stop right here, which will be 38 inches and 4/8. Okay, so again, we're going to write that down. Okay. All right, so we have upper abdomen, mid abdomen, and lower abdomen. Moving on to measurement 4 is going to be hips and bottom. Okay. Okay, so now we are moving on to measurement 4, which is our hips and bottom. Okay, so at this point, the arms no longer need to be up, but ideally just down and relaxed, okay? Now, also make sure that, whatever's comfortable for you and the patient, you can ask them where their arms can be. They can have them, placed over their tummy area, or just whatever is comfortable for them, okay? Now also, preferably, if you have patients who are comfortable with wearing thongs or paper thongs, ideally you would want your patients to be wearing thongs because we always want to measure bare skin. But if you have a patient who's comfortable wearing just regular underwear, but we still need to measure bare skin and they have regular underwear on, I'm going to ask my patient if they are comfortable with just kind of gently bringing their underwear up so I can be able to measure bare skin. So Diane, are you okay with kind of bringing your underwear up just a little bit? Perfect. All right. Again, you do want to make sure that you remember that your female patient's feet are as close together as possible. That's where this is the most crucial of the feet being together, okay? All right, so I'm going to do the same thing. So what I'm looking for is that peak of the bottom as well as the peak of her hip area. Okay, now this can get a little bit tricky because as women, we are all shaped very, very differently from the bottom area to the hip area. So if you're able to capture all of the bottom and hip fat at the same time, great. If not, then what you can do is mostly focus on the peak of their bottom fat, okay? So what we're gonna go ahead and do, and if you can't just show the audience real quick, facing the camera, sorry. Facing the camera. What we also look for is that peak about right in here as well, okay? All right, so I'm gonna just move back to the side so I can show them where I measure on the bottom. Okay, here we go. So when I make the adjustments, if you just want to spin around so they can see, sorry, everything. Perfect, okay. Okay, all right, then Miss Diane, you can turn to the left. Okay, all right, so I'm going to go ahead and record the measurement. We have 42 and 1/8, 2/8, and 3/8. So 42 and 3/8. Okay, now on this paper here, we have where it says measurement 5 men only, because this can also be used for men and women, okay? Now, obviously, if we are measuring the female, what we will go ahead and do is skip this cell here, and measurement 5 for the lady will be left thigh, and measurement 6 will be right thigh. So you can just put measurement 5, measurement 6 there, just as a nice reminder, okay? Sorry. Okay, I do make my marks in the front, just like this, for the hip and bottom area. And then on the side, and yes, on the bottom as well, okay? All right, so now we're going to move on to measurement 5 and 6. This is where we measure the upper thigh area. Okay, so on the paper, it talks about left thigh first, and then right thigh last, okay? So ideally, just go in that order so you don't confuse yourself. So we're gonna go ahead and start with the left thigh. Now this is where you're going to ask your patient to separate their feet about shoulder width apart. Just far enough apart where we can get in there and measure the thighs individually, okay? So I'm actually gonna go around, and her arms and hands can just be right here, okay? So what I'm looking for is that apex point in the upper thigh area, because in just one 8-minute treatment, that light is going to cover from under the bra all the way down to her upper thigh area in just one 8-minute treatment, okay? All right, so I'm gonna go ahead and measure about right here. And again, you do wanna make adjustments, okay? So again, I go around, and you just wanna make sure that tape is not too loose or too tight. Okay. And then go ahead and just kind of turn to the right just a little bit. Oh, to the right? Yeah, you're right. Sorry. Sorry. And then we're going to count the measurements. So 23 and 1 and 2. So 23 and 2/8. Okay. All right, now we're going to do the marks as well. So again, I just mark on each side of the handle. I do make a mark in the back. I make a mark in the front. And then of course, I always want to make a mark in my focal point, which is that inner thigh area. And of course, I'm going to repeat the same step on her right thigh. Now keep in mind too, not all thighs measure the same. Some do, some do not. So please don't ever think that you are measuring incorrectly if you have a thigh slightly larger than the other. That's actually more common than you realize, okay? Okay, so we are on to our final measurement, which is going to be our right thigh, which is measurement 6, okay? So we're just gonna repeat the same steps. We're gonna look for that apex point on the upper inner thigh. Sorry. Okay. Make sure that tape is exactly where you want it to be and you have the right tension. All right, and then Miss Diane, just turn to your left. A little bit more. Oh, this way.
Sorry.
You're okay. All right. Now, as you can see here, we're just a tad bit smaller on this side, and we are exactly right on 23 inches. So you have 22, and then right here is exactly 23 inches. Okay. I'm just going to repeat my marks. All right, and that completes all 6 measurements on the female body. All right, so one last thing I would like to cover with you when it comes to the male measurements. Pretty much every step that I went over with you with my female patient will be exactly the same thing to a T. The only thing that's going to be different is when you have your male patient standing in position, his feet do not need to be together. His feet will in fact be shoulder width apart, but those hands will still need to be at the collarbone with the elbows even and parallel to the floor. Ask him to stand nice and tall. Take that deep breath in and breathe all the way out. Also, the measurement placements will be slightly different. So again, like I said, we only take 5 measurements on the male, and we actually begin at the chest down to the lower abdominal. We do not go below the lower abdominal, so no hip or bottom or thigh measurements. So typically the first measurement is right across the chest, and the other 4 measurements are all across the belly. Okay, thank you.